If you look into the clinical nutrition market and the role of protein in the clinical nutrition sector, I think patient compliance is probably one of the key things that we need to look at. And what I mean by patient compliance is that the patient must be able and willing to consume the quantity of product that has been prescribed to him or her on a daily basis and do that continuously. And unless the product tastes good, the patient ultimately will stop or reduce his consumption. So the role of protein is quite important in this, to make sure the flavour is okay, the consistency of the product is okay, and looking very much to see whether the patient enjoys the experience of consuming that product. The trends there is to look at using ultra-filtered milk proteins like NPIs and NPCs, because the industry would agree that they have the best flavour profile than other dairy proteins like caseinate. And the trend that's happening at the moment now is that people are looking at substituting in NPI and NPC and taking out products like caseinate and putting back in some vegetable proteins to address the cost issues and also to address the flavour issues. In the area of protein hydrolysates, again, flavour is a very important attribute. Hydrolysates don't have a very pleasant flavour, so there's a lot of work going on to try and improve the flavour profile of the protein hydrolysates, and also looking at removing the use of animal enzymes in the manufacture of these products. Traditionally, a lot of animal enzymes, specifically porcine enzymes, were used in the manufacture of protein hydrolysates for nutritional purposes, and now the technology is there to use microbial-based enzymes instead of animal-based enzymes. And obviously that then opens up the opportunity for these products to be halal and kosher certified, which is important for certain markets.
Why is that? Well, why do they change?
If you use this, for example, if you use a porcine enzyme, that enzyme has been used traditionally in this market to supply a certain type of hydrolysate with a certain type of peptide profile. And obviously, because it's an animal-based enzyme, it cannot be kosher and halal certified because you're using a porcine enzyme. But by using microbial-based enzymes, you don't have that issue with certification from the kosher and halal bodies. But you must ensure that the nutritional value of the product remains the same. And the knowledge base that Kerry has in the whole area of applying protease enzymes to protein allow us to be able to address that issue. Well, we say if you look at the performance nutrition market, which is predominantly the sports nutrition market, that traditionally has been an industry that used only really one type of protein, that was whey protein concentrates and whey protein isolates, because that market was driven very much by the super athletes who were interested in muscle mass, retention and building and weightlifting and so on. And to be honest, the whey industry has done a very, very good job in selling whey proteins into this industry. I think it needs to look a little bit wider and look at other options around protein. For example, if you consume a whey protein, it has a very rapid rate of digestion. So you get a very rapid release of amino acids into the blood from the ingestion of a whey protein. If you consume something like casein protein, you have a much slower release of the digestion of the protein and the release of the amino acids. And I think the industry should look maybe at looking at a balance of both. There is benefit in having a fast release protein in the performance nutrition market, and also having a slow release, so you can get a maintenance of the plasma amino acids in the blood, and as a result you get more of a sustained release, and that's, I think, overall better nutritionally. The clinical industry has been doing that type of thing for years, using those types of mixes of protein, and possibly the performance industry should now looking at different types of proteins for that application as well.